Greetings, this is the coronavirus COVID-19 update for 3/14/2020. And the Baidu numbers are in today kind of early instead of a few hours later. This is the issue with trying to put this together is numbers don't get finalized for the United States until late in the day, and numbers don't get finalized for China until early in the morning China time, or noon, which is midnight United States time. So anyways, cumulative diagnosis, 81,048, up only 27 diagnosis from yesterday, which is a very, very small number. Suspected cases up 39. What China calls a cure, which is actually a recovery, 67,022. And existing severe cases, 3,226, 3,200 deaths. Then if you scroll down on this Baidu site, the site link is in the description below. The first thing you see is this map, which China is now using to show the total cumulative cases minus the recoveries. So that's why all these provinces are turning lighter in color every day. If you look at the upper right, this is about, I don't know, maybe 5 days ago they started doing this, or 6 days. I think I picked it up a day late. And all the provinces are turning lighter colors, except for Hubei in the middle. Then there's a couple maps, or I'm sorry, graphs if you scroll down. And this is the first graph, which is finalized. You can see the 3/14 date on it. This was finally done, I think, around 11 o'clock p.m. Eastern time in the United States. So new diagnosis 27, new deaths 10. You can see the lines there. Cured is leveling out, but one reason that isn't going up anymore is because there aren't that many people left to cure, because if you subtract the cured cases from the total diagnosis, that number is going way down. Then the other two lines, black is for death, gold suspected cases, and diagnosed cases in red. Then the next graph down separates Hubei province from non-Hubei. So the gold is non-Hubei province. Hubei province is in pink, and then the national number is in red. So you can see that these new cases are trending down everywhere. Then China started this third graph maybe a week ago, and it shows domestic new cases compared to foreign new cases. And you can see what's happening to the rest of the world, and China is pretty much leveled off. There's not many new cases every day. It used to be, back in late February, mid-February, China had, thousands of new cases and 100 deaths a day. It was averaging between 90 deaths and 120, with a couple of days 140, 150 deaths per day. Now that's all but vanished. Then if you scroll down further, you see a chart of provinces, and some days I show it opened up and some days I show it like Hubei province is open here with all the cities underneath, and some days I just leave it with the provinces. It depends on how they do it. Sometimes they leave it open, and sometimes they close it up and show all the province numbers. So Hubei, 4 new cases yesterday. That's really, really low. And then there's a graphic here of the rest of the world, which is nowhere near as accurate as what we use. So I don't know, I shouldn't even put it in there. But all of these screenshots that I'm taking here are from the same site. You just scroll down and you see all this stuff. The first thing is the chart and the graphs, and then you start seeing stuff like this. And then the search topics for today. Baidu is a search engine, and they track some of the top stories from around the world and from around China. And the search topics here don't always tell you what the story is, because sometimes the topics are crazy. But anyways, there's 5 stories we'll take a look at today. Number 2 here, U.S. enters a national emergency. We covered that yesterday. And also the torch relay, we covered that yesterday in the international news. So number 3 here we'll take a look at. So this is Ministry of Civil Affairs allowance for detained Wuhan personnel. So this is foreigners in Wuhan, and they have created a fund to help out foreigners with subsidies, because some people are stuck in Wuhan and can't get out. Then the story on the upper right, some guy from, I don't know what city this is in, I don't think it said, Wuhan. So he finally went down to, some people in Wuhan have been given a green identification card, which means they can go to work. So Wuhan is not on total lockdown anymore, but not that many people are, have the card yet. You have to be negative, and you have to have everybody in your residence is negative. So this guy went down to get in his car for the first time in 2 months, and there were little plants growing on his car. So that made the story. Then the one on the bottom right, I thought curry. I thought that was the other kind of curry, like red curry, things you eat. But they're talking about Stephen Curry. So there was an interview with him, and some people said he was trying to hold back a cough. But the NBA shut down. That made the news a few days ago. Then what do we have? A doctor from Guangdong was killed in a car accident, and that's unfortunate. He was just visiting for the epidemic. He was visiting the community, and he got hit by a van and killed. And that's the last story. Then this is the global tracker done by Johns Hopkins University and a research institute called the Center for System Science and Engineering. They put this together in early February, and they've been changing it and refining it and making it better every day or every few days, except for the graph on the lower right, which is worthless. So I don't know what's going on. I wrote to them about this. 156,000 cases, and your scale on the left only goes up to 100, and the graphs aren't touching the 100 even. But anyways, this is a good global tracker. And total number of deaths, total number of recovered, which is mostly China, and total confirmed cases, we're at 156,000 now. So the first thing I do with this is compare the Johns Hopkins China number to what China just published. And China's showing 81,048, and we're showing 80,980, so we're pretty close there. 20 plus 48, 68 off. Doesn't do much to change the number. Then I take a look at the 3 hot spots outside of China, which is Italy, Iran, and South Korea, although other countries now are starting to creep up there. These were the 3 that I've been tracking for, at least a couple of weeks. And Italy is just going crazy. 17,660 cases yesterday to 21,000. That's actually down from yesterday. They had several thousand increase. Iran, nobody knows if you can actually trust those numbers, but that's what they publish right now, 12,729 cases. South Korea is leveling off, and they're doing that. South Korea is the model country for the rest of the world to follow. They're doing the right, they're not even imposing lockdowns outside of Daegu, the city in the southeastern part of Korea, South Korea, where, this crazy church was recruiting people from Wuhan, and that's how they started that infection. But after it shot up to, several thousand within a few days, South Korea now has everything under control. On the right, the number of deaths, Italy, 1,441 deaths. Crazy big number for number of deaths in a country. Just crazy big. Iran, 611. That could probably be 10 times that much. Spain 195, South Korea 72 total. And you can see the increases from the day before. Italy had 1,266 deaths to 1,441. So the first hotspot we look at is Italy, and I have some small pics on the left that were from yesterday that I thought I would leave up here. So yesterday was a huge day in the number of people getting sick and dying in Italy, and almost 15,000 sick. Well, that was then toward the end of the day it went up to 17,000, and now it's up to 21,000. And on the lower left there's a picture of a nurse who looks like most nurses from China on the front line. Your face doesn't look very good at the end of a shift because they're not used to wearing masks. Nurses don't usually have to wear masks, but now that they are, they're finding that the masks are not real good for your face. Gotta feel sorry for nurses globally. Then the other news, don't even travel to return to the family. It says in here, if you really love your loved ones and, for the good of all, don't even come home. Don't travel, period. Italy is just on a lockdown now. They don't even want people that are, maybe away at college to come back home now. So crazy, lockdown in Italy now, where they're taking all kinds of, efforts, to try to stop the virus. And on the right, victims are 1,441. That's a little old, but it was in the news today. Oh, I'm sorry. The healed also increased. No, that's victims, 1,441. Yesterday closed at 17,000, today at 21,000. So that's new news on this site, but it's not up to date. Then there was an interesting story about this nurse. The shocked tale of a nurse. It seems the lungs are dying. So this is a nurse that is just explaining what's going on with patients, that what she sees happening every day. Grueling shifts, patients not only elderly but of all ages. That's what they're seeing in Italy. And they're talking about how they're dying. Lungs are dying. It's attacking the lungs, which is the same as most coronaviruses. The SARS is SARS and MERS are both the last two things are respiratory syndrome. So it's those both attack the respiratory system, and so is this new virus, COVID-19. And then Iran, the news from yesterday on the upper left, coronavirus burial pits so vast they're visible from space. So nobody really believes these numbers out of Iran. Some people think that tens of thousands are dead. And of course the news, I don't know why I include this Tehran Times up here, because there's just propaganda coming out of there. Sanctions showing their ugly anti-human face more than ever. Iran is trying to get the United States to lift sanctions. So the sanctions are so strong that the United States is refusing to do business with any country that does business with Iran. So pretty strong sanctions, but that's not the cause of your problems. There's the issue started with this pilgrimage to a religious shrine, and that's how you got infections. And the reason you had sanctions, you send a general to Iraq to recruit terrorists to attack the U.S. Embassy and kill Americans. Why? Because the attacks on the U.S. Embassy were being repelled by Iraqi Army troops and by U.S. Marines. So they repelled the attacks, over a period of a few weeks. And so Iran sent a general there to do the recruiting and say, hey, we're going to do a better job of it killing Americans than you guys are doing. And, the United States killed the guy. as he was leaving the airport, the terminal, he was still on airport grounds when 4 little missiles, 2 went into each car and killed everybody. The only thing was left out of this general was his finger, where he had a ring on his finger. That's how they identified him. So anyways, Iran then retaliated by shooting down a commercial airliner. Now you want the sanctions to be dropped because, that's crazy. No one's going to drop the sanctions. That's crazy. You send your army people over to another country to kill Americans, and then you shoot down a commercial airliner. And you want your sanctions dropped. If you can make nuclear reactors, you can make a mask. Okay, get it together and solve your own country. And then on the lower right, you can see the disinfections are, still going on across the country. But it's too late. And this made the news today. This was the religious shrine. Now picture the shrine. You can see a picture in the middle there of the city, or the shrine, the big building. These are thousands and thousands of people packed together, shoulder to shoulder, going on a pilgrimage, coming from other countries and from other parts of Iran to go to this religious pilgrimage in Qom, Qom is the name of the city. And these idiots, are now facing charges. These guys, that are licking the shrine, they're doing it to taunt coronavirus. They did this, they're not only are they staying in small little hostels and bunk beds and sleeping side by side and eating side by side, and they eat with their hands and going to the bathroom, side by side, and going to this pilgrimage to the site side by side. If one person comes down with coronavirus, they all get it. This is just an incubator for coronavirus. And then we have these idiots that are licking the shrine, just saying, I'm not afraid of coronavirus. So these guys are all headed to prison now. That's why they're making the news today. And then we have South Korea. So South Korea, upper left from yesterday, China and South Korea models seem to be the only way to contain COVID-19. Now China screwed up a bunch of times. One time by not locking down Wuhan, they canceled flights and let the trains run and let people, take 500,000 people left Wuhan after the lockdown and went around the world to infect the world. So that's one screw up that China made. And then also sending their military medics into Wuhan without protecting them very well. And now it's 3,000 people are infected, and a lot of deaths in the frontline medical people. And then yesterday also, South Korea announced this to the world, what they're doing. South Korea is not locking down any cities other than Daegu, the city in southeastern South Korea, where the crazy religious cult was. This religious cult has 450,000 members in South Korea. And this one church in this one city was sending people to Wuhan to recruit, and that's how they got the virus to begin with. So it went up to several thousand right away, infected people, because they just spread it amongst themselves in the church, and then they started spreading it to hospital people, and it got out of hand. But since then, South Korea is the model, for other countries to follow. They invented this thing, taking tests in cars. Cars are lining up. You give them your driver's license. They scan that. They take a swab from your mouth. They're disinfecting the whole city. So another thing that they came out with yesterday is they announced what drugs they are using, because they also lead the world in recoveries too. More recoveries every day than new cases. And we're talking about, a pandemic inside of South Korea that they kind of have a handle on now. So the drugs are, Kaletra, which is an American drug that's a combination of 2 other American drugs, lopinavir and ritonavir. Those are, 2 drugs that are, ritonavir is a well-known AIDS drug. And these are made by AbbVie, which is a spin-off of, a huge American pharmaceutical company, Abbott Laboratories. And, they're the ones that are making this new drug for the rest of the world. Upper right, Korea's new virus cases continue to slow. Infections top 8,000. That's from Korea Times and the Korea Herald. South Korea set to declare coronavirus hit city province as special disaster zone. So that's just that one city. But things are pretty much under control. The middle article from the Korea Herald, South Korea's virus cases continue to slow, total at 8,000. Then we have, who do we have? After those 3 hotspots, we have some other countries now that are trying to catch up with them. They're not as bad as Italy, Iran, and South Korea, but Spain, Germany, and France. So there's some stories from yesterday about Spain and what we have new. Coronavirus, Spain will impose a partial lockdown. So that's, Spain was kind of slow to react there. Madrid, there's a picture in the middle here about what Madrid looks like now, because it is a lot under lockdown. And on the upper right, another article out of Spain. Drones monitor streets of Spain and order people to go home. So there's a police guy, Polizia, and he's manning a drone, and the drone is looking for people, and he's using the camera, and when he lowers the drone and starts an audio saying go home, get off the streets. And then there's the wife of the prime minister came down with coronavirus. That seems to be pretty popular these days. Then what do we have? Germany. So sometimes it's hard to get news out of Germany for some reason. I look at the Welt, the World, and then Spiegel on the right is the Mirror, 2 of the biggest publications. And the World, we have called our reservists to report, military reserve, because the Army is busy doing war games probably with the U.S. It says our soldiers are challenged elsewhere, so they're bringing in the reserves. So that's a good idea. Hopefully they'll protect them, because that's one mistake that China made, was calling in their military without good protection. And then on the upper right, the most important questions and answers about coronavirus, that was published today. And then also they have a chart here showing the regions in Germany that were hardest hit. Then we have France. So France, just yesterday, the upper left story said that movie theaters will remain open, but with limited. They're going to limit the number of people that can go in and have them seat separately. And bars are still open, but today they shut down everything. Closures of cafes, shops, restaurants, and cinemas. And that's coming out of France 24. The Connexion. I don't know how you say that actually. That would be like a German way of saying it. Restaurants, cafes, non-food shops are closing. And on the bottom right, the story, France closes everything. So the Louvre, I don't know why they're showing the Louvre there. It's been closed for a month at least. But everything's closed down in France now. Then what do we have? BBC, UK. Look at the UK number, 1,143 cases coming up from I don't know what, because I didn't take a screenshot of that yesterday. But that's a pretty good increase. So out of the UK, supermarkets ask shoppers to be considerate and stop panic buying. You can see on the shelves there, I don't know what city that is, probably London. And then Jet2 flights to Spain turn around in midair over the virus. So they had a couple of flights leaving the UK headed for Spain, and they turned around in the air and came back. Some scientists say UK virus strategy risks lives. They're not, nobody in the UK is shutting down anything yet as far as, cities lockdown. UK deaths double in 24 hours. So UK is starting to creep up that list too. Then what do we have? These are just stories from yesterday because I tried to find new stories from today. Switzerland, Norway, Sweden, Netherlands, and Denmark. Anyways, these are stories that I had to look up news sites from each country, and they're on the next 2 pages, and I didn't find anything new to put up there today. This is the second page of the same thing. This is Sweden, Dutch, Denmark. Then we have the US of A. It went from 2,028 cases yesterday to 2,726 today. And what do we have on the right? We don't have the deaths in Washington. We'll take a look at that on the next page. So 2,726 cases, 572 are from the state of Washington, mostly in 2 counties, but there's a 3rd county now too. So King County is where the epicenter of all this stuff in Washington is happening. You can see Washington's the biggest circle here on the U.S. map. Total of 54 deaths, and 37 of those deaths are from Washington state. And then 12 recovered. That's also alarming. You know, we probably have the smallest number of recovered people than any country in the world. So what is the CDC doing here? You know, they screwed up with tests and let everybody get infected, and now it seems like people are staying in hospitals for months because some people there should be more than 12 people recovered. Like this 2 recovered from Illinois, that was our first 2 cases in Illinois, and you know they were recovered, I don't know, at least 2 or 3 weeks ago, 3 weeks ago. It's crazy. And then Mass was a Boston College student that's been recovered for. Nothing's happened as far as recoveries lately. And 1 recovered from Washington State. That was our first victim in the U.S. And in Wisconsin was a university student in Madison. Then what do we have? News for today. First, yesterday's news in the smaller pics. Trump declared a national emergency yesterday, which I think he committed another $5 billion. FDA issues emergency use authorization. This is a really good article that came out yesterday, and I don't know why it concerns only New York State Department of Health, because it's basically across the board. The FDA relaxed some rules about medical labs and institutes. You know, there's research institutes at every university, you know, in the country, and then there's research institutes and hospitals, and then there's private labs. And you know, FDA's been relaxing the rules a little bit about, you know, coming up with drugs to fight the disease. So what do we have from today? From Forbes, what is social distancing? This is a funny looking picture of a press conference, and I think that might be the White House, that little picture in the background. And you can see the reporters are, you know, a couple meters apart, or so that's one example of social distancing. Upper right, this was a study done in coronavirus testing information. They have every single state listed here, so you can look up this article and drop down and see what your state is doing. But there's just a lot of testing going on in the U.S. now, and it doesn't look like there's a shortage of test kits right now. Washington coronavirus death count hits 40 among 642 cases, and this is crazy. On the bottom here, of the 35 deaths reported in King County, 27 are associated with the Life Care Center in Kirkland. 47 staff people tested, 24 were negative. 47 tested positive, 24 negative, 18 to be tested later. And I don't think it's a lack of testing, it's just logistics. You can't send your entire staff to go get tested in one day. That would mean there's nobody in the center. So everybody from the same, you know, senior living place, you know, that's just, you know, going crazy with coronavirus issues now. Then the last thing that I have is this is a graph that I put together because for some reason the Johns Hopkins graph doesn't work, and it's not specific to any country anyway. So this is something I put together going back to 2021 when we only had 16 cases, and actually, you know, it took like 4 days to go from like 14 cases to 16 cases. And we went over 100 on the 1st of March, and since then it's just skyrocketing. You can see what's happening with the number of cases every day. It's just out of control. And most of this issue is, with all these cases is due to not getting things under control when the little pockets of coronavirus were small. Because the CDC didn't have any test kits. We didn't know who was sick. Now we know. Okay, that's all we have for today. Thank you.